Hello, Paulo Bricado here. Today I want to talk about quite a touchy or controversial topic, and that's whether testosterone replacement therapy is cheating. A lot of people, when you talk to them about testosterone replacement therapy, they kind of look at you funny, or in a way like you're cheating or that you're doing something wrong. And I think a lot of that stigma comes from the fact that all the bodybuilders and gym rats abuse testosterone, and they use it to get themselves, beyond normal levels, and that gives sort of testosterone in general a bad rep. But actually, testosterone replacement therapy in its true sense is something that is critical and necessary for people who are suffering from low testosterone. So what I'd like to do today is maybe just help you look at things from a different angle and give you a bit of context so that you can look at testosterone replacement therapy in a more subjective way and maybe in a more rational way, and not be swept up in all the hysteria and hype by your friends and family who don't know much about the topic. So I'm going to do that by giving you a very easy example to compare testosterone replacement therapy with, and hopefully that will help open your mind. So let's start. Let me ask you a question. Is testosterone replacement therapy cheating? Well, first, let's define what testosterone replacement therapy is. That is when you take external testosterone, usually via an injection, to get your low levels of testosterone up to normal levels. So, do you consider that cheating? Well, let me ask you this. If someone who has normal eyesight, their eyesight starts deteriorating over time and they decide to get glasses, is that cheating? If their eyesight is bad and they decide to use contact lenses, is that cheating? How about laser surgery? They have bad eyesight, they get laser surgery, and after laser surgery they have 20/20 vision. Would you consider that cheating? If you do, then most likely you're probably going to consider testosterone replacement therapy cheating as well, because it's the same sort of principle. When someone goes on to testosterone replacement therapy, it's typically, the prescription is usually prescribed typically when someone has low levels. You're not going to get a prescription unless you do it illegally from your doctor, unless you have low levels. And what you do is, if you have low testosterone levels, you get a prescription from your doctor. They prescribe maybe it's once a month or it's once every 3 months injection, and that injection sort of gets you from low to an acceptable level of testosterone. I myself have been on treatment. I'm not current at the moment, but I will be going back on. But before I started testosterone replacement therapy, I was low. And when I started, once I'd had my injections and I was on treatment, I was what you could consider still average. I wasn't even near the high region, which is still within the normal regions, but it definitely made a difference. Now, some people look at you funny because of that, but do people look at you funny because you wear glasses, or are you using some sort of trick or cheat when you wear glasses or you have contact lenses? Of course not. And if your eyesight continues to deteriorate and deteriorate, it's going to affect your quality of life because you can't see anything, and it's just going to affect you negatively. Now, the same thing is with testosterone. If you have low testosterone, it's hell. You go through anxiety, mild depression, you're weak, you have no energy or motivation. A lot of times you just want to lay around in bed and not even get up every day. No matter how excited and driven you are in your mind, for some reason you just have this sort of lethargicness that you can't get up and do anything, and you have no zest for life. So getting testosterone replacement therapy is critical. Now, how would you consider testosterone replacement therapy as cheating? Well, of course, there's a stigma here, and we have to figure out why. And this stigma comes from the bodybuilders who abuse it. They take testosterone levels way beyond the normal levels that a person normally lives with. And because of that, all testosterone usage is looked at like the bad guy or the enemy, when in fact there are legitimate cases where testosterone replacement therapy is required and should be used. Let's look at it in terms of our wearing glasses analogy. If someone has poor eyesight, they go to a doctor or an optometrist and they get it tested, and then they get glasses or contact lenses to help them see clearly again. Okay, they might even go for laser surgery, and that will give them even better vision. But that is all to get them back to their normal level of vision. It's not giving them any sort of extra X-ray ability. Now, let's say we had the technology to implant some chip in your eye that allowed you to see for, 20 miles ahead with some magnificent telescopic vision, or that gave you X-ray vision to look through buildings, or maybe even women's clothes. That would be cheating, because your normal level of vision doesn't give you that. And by having that enhancement, you're going beyond what your natural ability is. Okay? The same thing with testosterone. Getting it back to your normal level is not cheating. It's what you actually have to have done. Your life and your quality of life is going to suffer if you don't get back to the normal levels. Now, of course, if you go way beyond those normal levels and what's considered within the normal range, like a lot of bodybuilders who abuse steroids do, then yes, you could probably consider that cheating. So I hope this example kind of illustrates, where we're crossing the line between required amounts of testosterone replacement therapy and where you go beyond where you can consider it cheating. I think the glasses analogy is a pretty good one, and I just wanted to get that on video to maybe help clarify to other people who don't understand, what testosterone replacement therapy is and what should be considered normal and what should be considered bad or cheating. So thanks for watching, and you can look forward to more videos on the subject of testosterone in the future. Thanks. See ya. Bye.